12 characteristics of people with depression. 1. Shopping addiction. Is your shopping getting out of control? Do you find yourself trying to hide your spending? For some people with depression, impulsive buying in stores or online can serve as a distracting or self-esteem boosting activity. However, retail therapy is short-lived because it doesn't address the underlying depression. It should also be noted that shopping addiction can be a symptom of mania in bipolar disorder. 2. Drinking too much. About 1/3 of people with depression drink too much alcohol. If you feel the need to drink to cope with anxiety and depression, you may be one of those people. While a drink may seem to provide relief when you're feeling down, alcohol is a depressant, so going overboard can make depression episodes worse and more frequent. 3. Forgetfulness. Depression can be one of the causes of your forgetfulness and brain fog. Studies show that long-term depression or stress can elevate cortisol levels in your body. This can weaken or shrink the part of the brain associated with learning and memory. Depression-related memory loss appears to be worse for older people. But the good news is that treating depression can also improve depression-related memory problems. 4. Excessive internet use. Do you prefer virtual social interactions over real ones? Do you spend an excessive amount of time online? This could be a symptom of depression. Studies have shown a connection between high levels of depression and excessive internet use. People who use the internet excessively tend to spend their time on pornography, online communities, and gaming sites. 5. Overeating and obesity. A 2010 study at the University of Alabama found that young adults who reported being depressed were more likely to gain weight around their waists, which also increases the risk of heart disease. Other studies have linked depression to overeating, especially in middle-aged people. Treating depression can help with these issues. 6. Shoplifting. 1/3 of people who engage in shoplifting are suffering from depression. For some people who feel powerless and insignificant due to depression, shoplifting can provide a sense of power and importance. It can also provide a rush to counteract depression's lethargy. For people who steal because of depression, these feelings are more important than the item they steal. 7. Back pain. You have endless back pain? Research shows that depression may be a risk factor for chronic low back pain. One study found that 42% of people with chronic low back pain experience depression before the onset of back pain. However, depression can often be overlooked or undiagnosed because people do not associate it with pain and discomfort. Similarly, having chronic pain puts you at risk of experiencing depression. 8. Risky sexual behavior. Depression is often associated with a loss of libido rather than an increase in sexual interest. However, some people use sexual intercourse to cope with depression or stress. Increased random sexual intercourse, infidelity, sexual obsession, and unprotected sex can all be signs of depression. 9. Exaggerated emotions. Most often, depressive individuals show very little emotional expression. At times, however, they may show too much emotional expression. They may suddenly become angry and explode. They may express exaggerated feelings of sadness, hopelessness, anxiety, or fear. Some may become caught up in feelings of worthlessness or excessive or inappropriate feelings of joy. The key is a sudden change in behavior. If a person who is typically emotionally flat becomes excessively emotional, the cause may be depression. 10. Gambling problem. Gambling can be exciting and exhilarating. However, if you gamble more for the purpose of entertainment than for the purpose of gambling, you may be depressed or have a gambling addiction disorder. The likelihood of problematic gamblers experiencing depression and alcohol use is much higher than others. Many say they were anxious and depressed before they started gambling. Although gambling may provide a quick rise, it does not offer a significant reward, such as getting rid of depression. 11. Smoking. Are you having trouble quitting smoking? Being depressed doubles your risk of smoking. According to the U.S. Centers for Disease Control and Prevention, smoking more than 1 pack per day and smoking within 5 minutes of waking up are common habits of depressed smokers. Although smokers are less likely to quit smoking, they can quit. Programs that use techniques similar to those used to treat depression, such as cognitive behavioral therapy or antidepressant medications, seem to work. 12. Neglecting self-care. What does wearing a seatbelt have to do with depression? Suddenly, neglecting basic self-care may be a sign of depression and low self-esteem. Symptoms can be as small as not wearing a seatbelt and brushing your teeth, or as big as not seeking help for chronic conditions like heart disease or diabetes. Get help for your depression so you can start taking care of yourself again.
If you enjoy this video, please don't forget to subscribe the channel and like the video.